Hello and welcome to NHIS in a Week. Here, we give you highlights and happenings in the authority and beyond. My name is Ifia Trema. Now the headlines. New NHIS Chief Dr. Victor Bampo tours directorate, engages with staff and shares his vision. NHIS CEO meets Rage Hospital Management to strengthen NHIS partnership. And NHIS prompt payment system earns praise from Rage Hospital. The news now in detail. The newly appointed Chief Executive of the National Health Insurance Authority, Dr. Victor Asare Bampo, has hit the ground running with a tour of the National Health Insurance various directorates. His goal is to meet staff, listen to their concerns, and outline his vision for the authority's future.
Dr. Bampo received a warm welcome from employees, many of whom expressed optimism about his leadership. He reassured them of his commitment to teamwork, efficiency, and credibility, which are key elements in strengthening the NHIS and achieving universal health coverage, as President John Dramani Mahama directed.
And thank you for the welcome and all the hard work that you've done. And I hope that you can give me all the support so that I'm just one person working with all of you to take this authority to another level. Thank you.
As he settles into his role, all eyes will be on Dr. Bampo to see how his leadership shapes the future of healthcare financing in Ghana.
Also in other news, the Greater Accra Regional Hospital, also known as the Rage Hospital, has applauded the NHIA for its consistent and timely claims processing. This commendation came during NHIA Chief Executive Dr. Victor Bampo's visit to the facility last Friday.
During discussions, the hospital management noted that NHIS payment efficiency far outpaces private health insurers, ensuring smooth operations for healthcare providers.
Rage Hospital, as you see it, has what we call a corporate and prestige service.
Yes.
And it takes on private insurance, the diplomatic corps and missions, and then some other companies. And so if we want to compare them with you, then you are miles ahead of them, honestly speaking.
The payments come regularly, and sometimes it comes as a surprise and even baffles you. NHIS will always give you a report about what has happened and why you have been paid what. And I've been called into meetings and have things explained to me. That does not happen with the private insurance. All they'll call you is, let's do reconciliation. And I'm like, I'm not going to go into reconciliation. Just bring the Excel spreadsheet out. Let's have a dialogue, generate a report before we can have a discussion.
Dr. Bampo assured them that the NHI remains committed to strengthening and making the National Health Insurance Scheme more responsive. His visit is part of a broader effort to engage stakeholders, address challenges, and reinforce trust in the scheme.
Strengthening partnerships in healthcare is a top priority for NHIA CEO Dr. Victor Bampo, who met with Rage Hospital's management to explore ways to improve the NHIS efficiency and long-term sustainability.
President Mahama's directive was at the heart of the conversation to boost public confidence in the NHIS and push towards universal health coverage. Dr. Bampo also addressed financial sustainability, noting that challenges such as the withdrawal of U.S. aid support have created funding gaps.
When you talk about sustainability, especially with what is happening now with President Trump pulling funding, USAID stuff going, so there's a huge gap. I mean, like AIDS, like PEPFAR and things, for 20 something years, we've depended, PEPFAR authorization, Global Fund to fight AIDS, TB, and malaria. The money is coming until one day President Trump came in, just in 1 second, he turned off the tap.
However, he emphasized the need for innovative solutions and prudent financial management to keep the NHI strong and resilient.
I think that there is getting the funding, so increasing the sources of funds. But then there's also how you use what you have more efficiently and effectively. Because, and I say this with no disrespect to any of us here, but I think there's a bit of leakage in the system, and sometimes using funds for what they were not originally exactly, So if we're to guard our funding more, to use it for what it was intended for, maybe it would be a good start.
As part of his ongoing familiarization tour, Dr. Bampo plans to visit more healthcare facilities nationwide, ensuring that health insurance truly works for all Ghanaians.
The Greater Accra Regional Hospital has reaffirmed its commitment to stopping illegal co-payment charges where NHIS members are asked to pay out of pocket for services that the scheme should fully cover.
The hospital's management explained that their misclassification as a secondary facility despite offering tertiary-level services has contributed to some financial difficulties. This misclassification limits the hospital's ability to recover all costs under the NHIS, leading to additional charges for patients.
It's about the tariff. Our tariff are secondary, but our service is tertiary by infra standards. So we should make a submission, which we did, but we are told by policy, if you are not a teaching hospital, you can't be given the tertiary tariffs. So how do we resolve that issue, providing tertiary facility without teaching hospital or without medical schools, which is a condition for tertiary tariffs? So that, I think, has to be looked at the policy level. Otherwise, it means that we are heavily under recovering.
NHIA officials acknowledge the challenge and pledge to work with stakeholders to resolve the issue. Ending co-payment remains a top priority as the NHIA works to restore public trust in the scheme and deliver universal health coverage.
And finally, the third white coat ceremony marked the transition of pharmacy students at the University of Ghana from pre-clinical studies to hands-on clinical training, a major milestone.
Themed, Prescription for Change, Reimaging Healthcare, the event featured NHIS Dr. Ruby Mensah Annan as the keynote speaker. She encouraged students to advocate for healthcare affordability and equity, emphasizing pharmacists' critical role in healthcare delivery.
Let's be advocates for healthcare equity. Distinguished ladies and gentlemen, imagine a health system where everyone has access to the care they need. The mission of the NHIA is to ensure accessible, equitable, and quality healthcare for all residents in Ghana. To achieve this, I am happy to have led my team in the development of key initiatives to expand coverage and access to some critical services and medications. The expansion of the benefit package to include essential medicines and services that were previously unaffordable for many Ghanaians has not only improved access, but I think it has significantly reduced expenses, out-of-pocket expenses for patients to an extent.
University officials urged the students to embrace professionalism, continuous learning, and a patient-driven approach in their careers. For these future pharmacists, the white coat ceremony isn't just a tradition, but a commitment to ethical practice and lifelong learning.
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
After you son a line, ting.
Ina, look at you. What are you going to do in the office when you can just download their app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Please, Steph, I'm starting work next month.
It's a wrap-up on today's edition of NHIS in a Week. For more stories, kindly log on to our website at www.nhis.gov.gh. You can also visit any of the social media platforms displayed on your screen. My name is Ifia Cherma. Thanks for watching.